Good afternoon, everybody, and welcome to today's community conversation. We'll be getting started momentarily. We're just waiting for people to finish connecting. So just sit back and we'll get started in another moment or two. To those of you who may be watching the live stream on our Facebook page, welcome. And if you are watching live on Facebook and you have a question for the presenters, you can put your question in the comments field on Facebook and we'll translate that over to the Zoom meeting so the presenters can see your question. And if we get any links for resources, I will try to translate those over to Facebook as well so people have access to those resources. So again, we'll be getting started in just a moment. We're just waiting for everybody to get connected. It looks like we've got a good sized group today. And thank you all so much for joining us. So it looks like everybody who was trying to connect at noon is connected now, and I don't see anyone else in the waiting room. So let's get underway. Good afternoon. My name is Jeff Feldman. I'm the Director of Advocacy and Communications here at NASW New Jersey, and I will be moderating today's community conversation entitled Older Adult Bullying, a Neglected Issue in the Pandemic Recovery. Our presenters today are Colleen Beach, MSW LSW, and Heather Passarelli, MSW LSW. Colleen is a specialist professor at the School of Social Work at Monmouth University and a member of the Program for Gender Intersectionality Studies. And Heather is a recent MSW graduate from Monmouth University and a previous intern with the Woodbridge Township Division on Aging. And they will be sharing their information about older adult bullying with you today. A couple of items just before we get started. We will be having a couple of points where the presentation will pause and the presenters will check for questions. So if you have questions, you can go ahead and put those in the chat. But we'll also have places where we pause and you'll have the opportunity to give feedback in the chat or raise your Zoom hand to unmute and speak. Also, I do want to remind you that this program is being recorded for future use, and it will be available on the NASW New Jersey YouTube page after the presentation. We will also send a link to the video to everybody who registered for this meeting so you can watch it on demand if you need access to it again, and share it with others as you'd like. Also, just a reminder, since we are recording, if you're not speaking, please keep yourself on mute so we can avoid any background noise or disturbance to the recording. And other than that, I think we are ready to go. So I'm very happy to turn things over to Colleen and Heather.
Thank you. Welcome, everyone. Heather and I are really excited to speak with you about older adult bullying. Our conversation about this topic started in the classroom. For me, I know my interest started many years ago when I was working more in direct services with older adults in adult daycares or residential health settings, nursing homes. And Heather has a really interesting, broad, expansive experience in terms of across the lifespan, which adds a nice complement to the experience I have to offer. And we're really looking forward to seeing what you have to share with us in terms of a conversation and opportunity to collaborate. Heather, do you want to go over our agenda a little bit?
Yep, I'm going to start sharing our screen so we can pull up our PowerPoint and you guys can see. So just let me know if that looks good. Can everyone see it?
I can.
Okay. So we'll get started with our agenda. So if you want to add in the chat some introductions, we would love to know kind of what brought you here, what settings you're coming from, just so we all have some kind of background with each other. And so today we're going to define and differentiate some terms: ageism, elder abuse, older adult bullying. What does bullying look like in older adults? We're going to kind of have that open discussion, see what some of you are seeing in your experiences as well, and an overview of some of the options to address this issue and some questions and conversations that we're going to have. So I'm going to take that away. Is older adult bullying ageism, elder abuse, or something else altogether? We're going to look a quick review of the facts and figures.
So when Heather and I first started talking about older adult bullying, one of the first thoughts that I had really was looking at ageism and seeing, well, what does the research say about older adult and bullying and ageism? And really with ageism, we have to think about how pervasive it is in our society. You know, we can't even walk into a Walgreens or any kind of store that sells greeting cards or health and beauty products without having ageism really kind of literally on our face or in our face in terms of the products that are out there. But, you know, ageism doesn't typically come alone. We find that ageism, and in this context, we are looking at ageism affecting folks who are 60 plus. That doesn't mean that ageism is reserved to only people who are 60 plus, but in this context, that's how we're looking at it. Ageism typically will be part of an individual's multiple social identities. And of course, we carry those with us everywhere in life. If you're familiar with the Elder Justice Roadmap, which if you're not, I highly suggest you take a look at it. It offers a great opportunity for us to think about what we can do to promote prevention and addressing elder abuse. But the Elder Justice Roadmap highlights ageism as one of the issues that really is a cross-cutting theme with elder abuse, in that it touches on each element of how elder abuse is experienced and addressed. As well, age discrimination affects health. And I'm going to read this just so that I don't forget anything, but I thought that you might find it interesting to hear about the ways in which ageism can impact new onset of health issues, such as coronary heart disease, stroke, chronic lung disease, depressive symptoms, limiting long-term illnesses, and folks who have experienced ageism will report a fair or poor self-rating for health. If you have been following some of the federal policies and recommendations, you'll see that there has been a focus on the 7 conditions for health and well-being. And if you're not familiar with those, we do have a resource at the end of our presentation that can offer you a link so you can learn more about those. But part of those 7 vital conditions is belonging and civic engagement, and being free from the impacts of discrimination and oppression are really vital parts of that condition for folks to really meet their capabilities and progress as well as they possibly can. In a study of over 7,000 people, 25% of those folks reported experiences of ageism. And we have examples of ageism and discrimination being key issues in our social determinants of health. Some of you may be doing screenings for social determinants of health at your healthcare settings or social settings. And certainly we know that discrimination is an indicator that someone may be experiencing health issues. If you are using screening tools for social determinants of health, it'd be interesting to see in the chat if those are tools that you're currently using, and if discrimination is something that you're looking to discuss with your clients. Heather, if you could go to the next slide, please.
Yep, I am. I'm not sure why it's not going.
I've had that happen to me before. Sometimes you need to escape and then go back.
You're right. This should be the right slide.
Yes, that's it. Great. So one of the pieces of our description was looking at the recovery efforts from COVID-19. So it felt particularly important to highlight ageism in the context of COVID-19. And we know, if you're here, then it's probably no mystery to you that ageism was a huge issue that really was exacerbated during the height of the COVID-19 pandemic and continues to really be an issue. What I found interesting when I was going through the research was despite the fact that, when you speak with people who are in the field or out in the community, anecdotally, we hear people talking about how really these multiple social identities and the ways in which discrimination and oppression are affecting people are kind of have been converging. And, I'm using the term isms. We're talking about classism, racism, sexism. I'm sure you could come up with many more. Unfortunately, there's no dearth of examples. But in order to be considered one of these isms, there needs to be three components: stereotyping, prejudice, and discrimination. And of course, the difference with prejudice and discrimination is the acting upon that prejudice and kind of the institutionalization of that prejudice into policies and operationalization of that prejudice. So we saw many examples of how those different experiences of discrimination came together. One I'm including here is just that intersection of classism and ageism, where folks were really experiencing heightened social isolation, loneliness. Heather did an amazing project during her internship trying to reduce the effects of the digital divide. Today is a perfect example of how, access to technology is really vital to have communication. We saw many other examples of how these isms kind of converge to affect people's lives. But what fascinated me, and of course, I work in an academic setting, so I guess my brain just works this way. But I thought it was fascinating that I did find a literature review reviewing the articles and the scholarly research that was out there about ageism. And out of 354 studies that were between 2019 and 2022, not even 10% of them talked about the impact of these intersections on the lives of older adults. I think that that's relevant to our topic of bullying, because when we were also, Heather and I were both looking to make sure that we had, the most up-to-date information for you. We didn't see a lot of new content on older adult bullying since the pandemic. And I think, maybe I'm making a big leap here, but I think those two things are connected as to why we aren't seeing these connections being made. If we could have our next slide, please.
I think I'm at escape and
There you go. We're good. So with elder abuse, you may have seen multiple definitions of elder abuse. So we're kind of shifting now from looking at what is ageism and how is ageism affecting people, keeping in mind those three elements of the isms. We're now looking at elder abuse. And I prefer, and we'll see in a lot of the scholarly research and a lot of the advocacy organizations, this definition from the World Health Organization, where elder abuse can either be a repeated action, or it can actually be just a single act that is considered an inappropriate action that occurs when there's a relationship with individuals in which there's an expectation of trust. And that really is a key element to that definition of elder abuse. And that is the definition that is used more on a global scale. And of course, in addition to this inappropriate action being perpetrated by someone who is in a relationship and when there's an expectation of trust, this also causes harm or distress to the older person. Some of you might be familiar with the National Clearinghouse on Abuse in Later Life, where they look at abuse of folks who are 50 and above. And in their definition of abuse in later life, they actually change things up a little bit, and where they do have this definition where they're looking at abuse being perpetrated by someone in which there is a relationship or an expectation of trust, but they actually expand it to also include instances of sexual violence in which there isn't necessarily a relationship with the person prior to that act of violence. But in our context, when we're looking at folks who are 60 and above, we're really looking at whether or not older adult bullying fits into this definition of elder abuse. Is it elder abuse? And if it is, most of us, I'm making an assumption here, and just because I didn't have a chance to look through all of the introductions yet, I think most of us are social workers here. We know that we're mandatory reporters. So if older adult bullying is elder abuse, and that means that, you know, we are ethically obligated and legally obligated to do something about it. The Department of Justice uses a slightly different definition, and just because I've been following definitions over the past few years, sometimes those definitions change depending on who's at the top. But this has been a fairly consistent definition from the Department of Justice, in that it is an intentional or negligent act by any person that causes harm or a serious risk of harm to an older adult, which kind of shifts the definition a little bit. So that is something for us to kind of think about and ponder as we're moving on. Heather, can I have the next slide, please?
Yeah, I think it's delayed, so.
Okay. So one of the things that is important, just like ageism, which is pervasive throughout not just our society, but really in a global context, unfortunately, elder abuse is also experienced in a global context, whether it's in global north countries or global south countries. There really is a, I mean, I'm not sure if universal is quite the right word, but a far-reaching experience of elder abuse throughout the world. And again, I turned to the research to find out, well, you know, how big is this issue? And this is the most up-to-date that I could find. And I realized that it's a few years old. We don't have information post-COVID yet, or if it exists, I haven't seen it. If you know what's out there, feel free to put it in the chat. But we do see that in a overview of 52 different studies in 28 different countries, really diverse. We've got those in the global north and in the global south, that this is something that is experienced approximately 15% of people who are 60 and above. In the United States, the research supported about elder abuse being experienced by about 10% of people who are 65 and older. And of course, we know that we for sure have research and anecdotal evidence that during particularly the lockdown and the months ensuing, that experiences of elder abuse were rising during the pandemic. Next slide, please.
Okay, so now we're kind of going to talk about if older adult bullying creeps into the elder abuse category. So bullying, we know it can be direct and indirect, and there's different types of bullying, such as verbal, physical, relational, damage to property. The most common bullying in a long-term care setting is verbal bullying. And so there is no differentiation amongst genders as to who will perpetrate these bullying behaviors or the victim of them. And so bullying is also sometimes called harassment, which happens when someone hurts, intimidates, or scares a person consciously or unconsciously. So I think it's important to note the intention, because it could be unconscious as well. And when someone is being bullied, they often have a hard time defending themselves. And it's usually not a one-time event. So bullying can happen over and over again. So 3 of the key elements of bullying is aggressive behavior that involves unwanted negative actions, it being repeated over time, and an imbalance of power or strength. So just being aware it can happen in any place, context, or location. And at times it can fall into criminal categories like hazing or assault. So it's notable too that there's no requirement for a power imbalance if a criminal act occurs in the context of bullying. And so just also taking note that it happens any place, context, or location, which is important. So now looking at the overlap and the differentiation of bullying and elder abuse. So some of the things that overlap is people who engage in elder abuse often also engage in bullying behaviors by harassing or intimidating the targets of their abuse. So that's kind of the thing that bullying and older adults have in common, is just the behaviors. But the differentiation is important to note that bullying is based on peer-to-peer interactions and not perpetrated by a person in a position of trust. So it doesn't necessarily include all 3 components of the isms that we talked about when we're thinking of bullying. And it's just key that bullying is peer-to-peer and not by a person that we trust. And abuse can occur in one instance. Bullying is something that happens over time, and it usually involves more than one instance of this kind of aggressive and intimidating behavior. So when we're thinking about the target of bullying, the person that's being targeted, there are some risk factors that are important to note for people that may be at risk of being a target. So they're listed here. Some of them are being a new member of a residential community, or just a new member in a community, being perceived as vulnerable, not knowing what to expect from others, maybe someone that's widowed or divorced and is living alone or anything like that, having a scattered support network, heavily depending on others, experiencing mental health disorders, a change in health conditions, or just having a quiet and passive demeanor. Those can be just some things to look out for risk factors for a target of bullying. And then we also have some side effects, possible effects of being bullied, which would be reduced self-esteem, cognitive health, emotional safety. It can cause anxiety and depression, isolation, and we wanted to note in extreme cases, bullying can lead to death. And I think it's extreme, but it's important to recognize the severity of this issue.
So I'm going to talk a little bit about some of the characteristics about older adult bullies. Before I do, I wanted to tack on with what Heather was saying about the extreme cases. One of the examples that I saw in the literature, which really I thought was stunning, and it connects back to that definition of, sometimes bullying can also be a criminal act. There was an example of a woman who was recently widowed, who was living in a skilled nursing facility, had been living with her husband. He passed away and had a new roommate. And the behaviors of this new roommate really were bullying behaviors, isolation, intimidation. They were repeated. The woman who was being bullied complained to the staff, and of course we can never get into the mind of other people, but the bottom line is that not enough was done in order to stop the bullying. And this woman actually ended up being and I'm sorry if this is a little too blunt, but she ended up being found dead and the estimation is that it was at the hands of the roommate. She was suffocated to death. So, we can see where there are these extreme circumstances where, bullying can be, really deadly. But what do we know about older adult bullies? Some of these characteristics may seem familiar to you. I did get a chance while Heather was talking to look at some of the descriptions of places where folks are from. Some of these may be familiar to you, even from, all of us lived through school and playgrounds ourselves. So some of you may recognize some of these different characteristics of people who bully. There's a lack of empathy. Typically, bullies don't have a lot of friends. They will often use power and control at the expense of others. They may have low self-esteem. There is often a sense of empowerment by causing conflict, in that when other people are feeling threatened or hurt, this actually helps the person who is bullying feel a heightened sense of empowerment themselves. Something that we wanted to make sure that we noted was, bullying behaviors can be behaviors that people utilize throughout the course of their life. One of our really key messages is that bullying is a life course issue. So sometimes we do have folks who have been using bullying tactics throughout their entire lives. And then at other points, we may have people who stepped away from using those tactics to gain more control over their environment, to now all of a sudden being in a new environment where they do feel this loss of control. It is in of itself a more controlled environment where they may be struggling to regain that sense of control, and maybe reverting to bullying behaviors because of that new sense of loss of control. I had the good fortune of working on a presentation with Dr. Kirsten Madsen, who is a scholar from Canada, and she is working with other folks on an anti-bullying toolkit for people who are living and participating in older adult communities, and for the professionals who are working with them, and of course loved ones. And one of the things that she brought up, which I thought was, I don't know, it just particularly struck me, is that sometimes folks who have bullied throughout their lives, they get to a point where they get really, really good at it because they've had a lifetime of perfecting these behaviors and finding ways for them to get them what they need and get them what they want. That doesn't mean that is necessarily the case for everyone who uses bullying behaviors, but I thought that was a particularly powerful statement, and one that stuck out to me. This statistics of 77% is actually from Dr. Madsen's research. She conducted a study in Ontario where they reached out to folks in older adult communities, and they gathered different statistics of who's experiencing bullying, who is perpetrating the bullying behaviors, who is witnessing them. And it was very interesting from this study that she discovered, and her colleagues discovered, that folks who are engaging in the bullying behaviors, 77% of them actually stated that they find engaging in these behaviors upsetting or extremely upsetting. And I think that is something that if we are working with a situation where we need to intervene with folks who are both experiencing bullying and engaging in the behaviors, it is important to recognize the impact that has on them as well. So often, and of course, rightfully so, we err on the side of really focusing on the person who is vulnerable. But I think we might also think about what that experience is like for the person who's engaging in this behavior. Something that also is important to distinguish is I worked in settings where there were many individuals who displayed aggressive behaviors, and these were related to disease progression, where someone may be acting in an aggressive way, but it's maybe due to a type of dementia that they're experiencing. Just because someone is engaging in aggressive behaviors doesn't necessarily mean that it's bullying. And it's important to distinguish, is this a situation of bullying, or is this, person to person aggressive behaviors, and really trying to figure that out. Something that I also found pretty interesting in terms of just even where the bullying is happening. The research supports that bullying behaviors and folks who are doing the bullying tend to be in settings where there is less cognitive decline, so that the people who are bullying tend to be people who are higher cognitively functioning. When you think about it, it makes sense, right? There needs to be a lot of executive functioning that happens when somebody is engaging in these acts of intimidation and repeated acts. These are often premeditated. That's not to say that they may not happen on the fly, so to speak, but sometimes people make assumptions that bullying is happening in settings in which people are experiencing dementia or other kind of cognitive impairment, but the research actually doesn't support that. Next slide, please.
Okay, so turning over to kind of the results from witnessing bullying response, the responses that people have. So people that witness bullying, some responses they have would be, freeze, the safety and fear of reprisal. Some people, will say it's none of my business, and they kind of just stay out of it if they're witnessing bullying. Only recognizing it as bullying after the fact. So it's kind of important to look into some of the ways that people respond when they're seeing bullying, because it creates a toxic culture of anxiety and mistrust for pretty much everyone involved. So on the left side here, we have some of the quantitative data just showing people's responses of how, they felt when they were witnessing bullying. Some didn't know how to help. Some felt they were in a dangerous situation. People feel frightened of being the next target. Sometimes people say they didn't know the person being bullied, so they didn't get involved, or the person being bullied was their friend. So these are just some key things. And also, for those who witness bullying behaviors, 45% reported feeling anger, 18% worried that it would happen to them. So just a quote from a survey respondent saying, I would like to stand up for the person, but I would be the next one to be bullied. So fear of being a target is a big kind of prevention of people stepping in when they're witnessing these types of things. So some questions we have here: approximately what percentage of older adults in communal settings witness bullying? So for that, we found that about 30% of people in these community settings are witnessing bullying happening to their peers. So that's a pretty big percentage. And then the percentage of older adults experiencing bullying in these settings. So there's different research. So it's between, in the US, a lot of the research is showing 10% of people are experiencing bullying. There's research in Canada that's showing between 10 and 20. So they're showing kind of higher numbers for name calling, bossing others around, physical aggression. And just to note that some other bullying behaviors common in the senior population could include criticizing or ridiculing someone for their clothing, social status, religion, sexual orientation, verbal or physical abuse, maybe yelling, hitting, pushing, kicking, stealing or destroying of property, lying about the victim in order to assert power or authority, saving seats or reserving spaces for clique members in dining rooms is another kind of big one, because this behavior might seem innocent, but it can be hurtful and kind of outcasting people So something to keep an eye on just as a bullying behavior. So just some examples of behaviors that may be witnessed in these settings. So now we kind of want to hear from the audience. If in your own settings, the settings that you're working in, what are some of these behaviors that you're seeing? What's happening where you're working?
And you can feel free to put those comments in the chat, or if you'd like to raise your Zoom hand, we can have you unmute and you can speak directly.
It would be interesting to hear if you're not seeing these behaviors, because one of the I guess assumptions maybe that we're working from is that bullying happens across the lifespan and that it happens everywhere. So it would be really interesting to see, maybe you're not witnessing it. So putting in the chat or verbalizing, what you are seeing, or even if you're not, would be really helpful. Jeff, do we have anybody that wants to jump in, or should we move on?
I don't see anybody yet, and I don't see anything in the chat. I figured we'd give people a minute or so to type if they were typing, but otherwise, I think we can go on.
Okay. So am I not using my therapeutic use of silence here?
We'll practice it for 30. We'll practice it for 30 more seconds.
Got it.
Tolerate the silence.
Yes.
We'll give it a few more seconds, and then we can always jump back to it at the end if we're having any more conversation.
So Tom in the chat says, what I see in my work with children is a lot of hiding of personal possessions. He's surprised to hear that it continues in older adulthood.
Definitely. That's very interesting. I noticed in my experience a lot, I've worked in a middle school and then working with older adults, that it's surprising how many of the behaviors kind of continue through the lifespan. So I really appreciate that comment.
Yeah, thank you for sharing, Tom.
Yeah. And I think it's just interesting to point out, seeing that maybe people haven't seen it, or, we're not sure what the behaviors are. For me, in my experience working with older adults, before kind of, I think a lot of people, I know I did at first, think of bullying as something that happens with kids. And it's before being educated on the fact that this is a lifespan issue and that this is happening a lot with older adults, I didn't recognize the behaviors. But then, watching more after learning it, I recognized that a lot of this is going on in those community settings. I was in a senior center. So just interesting that maybe after getting some of the info, you might recognize some more of those things.
Emily has shared in the chat, she's heard about residents bullying new residents, especially those with different needs or who were formerly homeless.
Mm-hmm. That's a good point too. One of the key in the senior population being, social status, being new there, or their economic background. It's definitely something that comes up.
Yeah, I was actually just thinking that I was just going to ask you if there was anything that showed that like economic background was part of the bullying, and that maybe folks who are better resourced or come from a better economic situation would use that in a power situation against people who aren't as well set up.
Yeah, certainly something that does happen, and it's in the senior population one more common types of criticism that's possible. So yeah. Okay.
I think we can move on.
Yeah, I think we'll move on to the next, and we can always come back if anyone has anything to add later on.
Okay, so we just wanted to offer you some additional examples of what those different kinds of bullying behaviors are. And maybe when you see these, you might recognize them. Of course, the great hope is that you're not seeing any of this, but when you look through, perhaps there will be some that you are witnessing, in fact. And if you do feel like you're witnessing them and you want to put that in the chat, like, oh yeah, I didn't really think about that as bullying, please feel free. But we do see, I paired up different kinds of bullying behaviors. So our research supports that there's 4 different maybe categories of bullying behaviors: verbal bullying, relational bullying, which I believe the research supports that girls earlier in life engage in more relational bullying, whereas those who identify as males tend to engage in a different kind of bullying, which would be our other categories of physical or destruction of property. As I think Heather actually mentioned earlier in the presentation, the research supports that verbal bullying seems to be happening in more of the communal settings, like assisted living or maybe a skilled nursing facility, and that it's kind of equal opportunity. There doesn't seem to be a differentiation amongst the genders. But I did at least see in one example that there is an assumption that women engage in more verbal bullying. And I think actually, Heather, you pointed this out. Didn't you say that you saw somewhere about men engaging in verbal bullying later on in life?
Yeah, there's some research that I was finding in the workplace, so more like middle-aged population experiencing bullying, and that males are experiencing it in a little bit of higher levels than women actually in that setting, but that was just one article.
Okay. So again, some of the examples would be, bordering on and merging into sexual harassment. A common example that at least I witnessed was isolating a person, ignoring them, making sure that they don't have a seat at the table. Again, behaviors that probably if we reached back into our own mental archives, we know that we saw at earlier points in life. Sometimes those behaviors and really the tactics don't go away. Again, thinking about Dr. Madsen's work and some of the statements she said, they don't necessarily change. They maybe become more sophisticated, but they work. So folks continue to use them. If you could go to the next slide, please, Heather. And some of the other examples of the other 2 categories, damage to property, or even physical bullying, they both exist. Something that is interesting to note is that bullying tends to happen in spaces where there may be witnesses, corridors, congregate meal stations, whether it be a dining room or like at a senior center, in activities areas. I was an activities director for many years, and certainly I'm sad to report that it was something that I saw happening in activities. It would be nice to have a joint workshop with folks who are recreation therapists or activities directors to see what they're experiencing. But these are examples of some of the physical manifestations of bullying. And again, it's really a sometimes more sophisticated attempt at behaviors that worked earlier in life. Heather, the next slide, please.
Got it. So looking at the evolving awareness of bullying, we've been bringing up some of the lifespan conversations. So this image kind of shows how formalized anti-bullying policies in schools was increased in the late 1990s to 2000. So, things kind of increased in that time, and we started talking about bullying in schools and with children. And then we see some policies form around workplace bullying. In the research we were doing, I was finding a lot of workplace bullying, which kind of brings us over to that middle-aged, kind of working age population. And then older adult bullying research starts to be seen around 2007 and on. And so, this awareness we can find at residential communities, assisted living facilities, skilled nursing facilities, senior centers, adult day centers. The awareness of bullying continues to grow in all of these settings, and it's important to have these conversations because 10 to 20% of older adults in these communities are experiencing bullying. So research is going to be something that hopefully we keep seeing.
Heather, I noticed that we're at about 12:47, and we wanted to get some feedback from folks on what they were doing. Do you mind if we move ahead to the slide that says the goal in terms of reducing stress and seeing what folks are working on?
Yes, would that be this one or is it the next one?
Perfect. So we really wanted to get a sense from you of how you're addressing it. So we had some comments in the chat of ways in which folks are seeing bullying at different life stages. We'd love to hear from you to see, are you engaging people at a one-to-one level? Are you looking at bullying at more of an organizational level where the intervention is there? Are you focusing more on the family and expecting the family to intervene? Is it fragmented, or are you really looking at more of a kind of, as social workers, that person and environment, kind of using all the elements together? We want to hear from you. This is really your chance to shine and tell us what you're working on. Is there anybody that would be willing to share a little bit about what they're doing?
You can raise your Zoom hand or put some comment in the chat if you'd like. And just remember, if you are sharing any information, just to not use any client names or identifying information.
Thanks, Jeff. I'm sorry I didn't mention that.
No, that's fine. Emily, do you want to unmute and share what you have to say?
Can you guys hear me?
Yes. Hi, Emily.
Cool. Hey, so I work at a library and we do a lot of outreach programs at the senior centers in town. So we were actually contacted by one of the resident directors there to discuss this problem that they're seeing in the senior centers of bullying amongst the residents, and I think kind of like bossy residents who tell other people what to do. So that's something we're trying to work on, is bringing in programs that address these issues based on what the staff is seeing. So I think we're still new to this. That's why we're interested in this webinar. But if you had any feedback or suggestions, that would help.
Interesting. So they reached out to you, and are you a social worker embedded in a library?
Yeah, I work at the Hoboken Public Library. So I'm their main social worker. So I work with the community engagement department to bring programs out into the community, and that includes the senior centers in town.
Interesting.
Emily actually wrote an article for NASW New Jersey Focus about her work in the library. I think it published in our spring issue.
Yep.
Excellent. One of our Monmouth alum is I'm not sure if he still is. I think so. Is a social worker embedded in the Long Branch Public Library. I was very excited when he was in my field seminar class and we got to learn about it. What an awesome opportunity to get to do some really good community engagement. We have some suggestions from the literature, but it'd be great to hear from other folks before we jumped into what the scholars say. Sometimes well, not sometimes, I feel it's equally as important to hear what the folks who are really engaging with these issues every day have to say. If anybody has suggestions or what they've done, that'd be great. I see a comment here from Tom. In my work as a teacher, we regularly receive mandated training. Perhaps from an organizational level, it would be worthwhile to have more organizational training for practitioners to intervene. Yeah, absolutely, without a doubt. Any other thoughts?
Thanks, Tom.
Thank you. Well, how about we bounce to our slide that has community in it? So, when we were thinking about this issue and really the way to address it, I think, and Heather, tell me if I'm talking out of turn here, but I think one of the things that we really wanted to focus on was, because this is a life course issue, is that the answer really lies in addressing this as a community, and that this isn't just like an I thing, like, okay, well, I as a staff member have to respond, I as a loved one have to respond. This is really more of a we thing, in that we as a larger community and culture have got to address bullying everywhere. And, the schools are a start. And we, like in New Jersey, we have the HIB, policies, but that's not enough. We need a whole lot more, and we really need to embrace this as a community issue. Again, looking at those 7 vital conditions, everyone needs to have a sense of belonging. And if they don't, then that impacts their health and well-being. And when we're not focused on that as a larger community, then we pay the price as a larger community. So some of the recommendations are coming up on the next slide for the 8 is enough. Maybe we'll go to that one. So this is for my folks in my generation. I'm hoping you get the 8 is enough reference. Thanks, Jeff. So our focus really is 8 is enough. So to create, communicate, and advocate. And this was how I kind of summarized what the literature was saying. So, and I hope this will be helpful for you, Emily, and anybody else that is trying to cope with this issue. The idea really is to try to create an organizational culture that doesn't tolerate bullying, and that has a sense of accountability. So some of the recommendations, and I'm going to look at my notes for some of this, so I apologize if I'm looking down, but I want to make sure I don't leave anything out. Some of the suggestions are creating clear rules and expectations for residents or clients or member behavior, but also for staff behavior. Like Heather was saying before, workplace bullying is a thing. Perhaps some of us have even witnessed it. And in addition to the research that we found on bullying happening to folks who are utilizing, healthcare communities, we also saw a lot of research out there about bullying happening within the workforce in these settings. So we need to have an organizational culture of safety and respect and accountability for behaviors across the board. The idea in terms of creating the organizational culture means involving everyone in determining what rules and expectations should be. Of course, as social workers, this is probably something that's natural to us, that this isn't something that should be top down. This is something that should be a kind of an organic growth, really embracing the comments and suggestions of the people who are impacted most. Sometimes when we're working with people who aren't social workers, they don't necessarily embrace that. So we might need to do a bit of a hard sell on creating an organizational culture that includes the folks who are impacted most, whether that be clients, members, or residents. Consider expectations, that there needs to be a policy and plan in place when it happens is too late. So the idea is, if we're witnessing this and we're trying to go back and put a Band-Aid on it, then we've really missed an opportunity. The idea is to try to work from a perspective of this is going to happen because evidence shows that this is a life course issue, and we need to therefore have a policy in place and have a plan in place. For folks who are in settings that are already open and running and you don't have a policy, I think that it's not too late. It just means that we have some catching up to do, really. There were some suggestions of having language in admission agreements, or I'm not sure in the senior center. Maybe you can answer this, Heather. I don't know if there's any kind of agreement that people sign as members. It's actually one of the few places in with older adults that I haven't worked. So there is. Okay. So, whether this be somewhere that someone lives 24/7 or someone is utilizing the services, adding language into the agreement upon admission is a recommendation. Discussing the expectations of the organization's culture of safety and accountability when someone is looking at the setting. And I found an interesting statement that if you ask a facility how they address bullying or amongst the residents or clients or members, and they tell you it doesn't happen here, that should be a red flag. So I think that's important for us as professionals to remember, to know that message is out there, so that if somebody does ask us and we have a tendency to want to try to gloss over it, and sometimes we're put in this position of trying to sell, which can conflict with some of our values, right? But when we're trying to sell how amazing we are, sometimes we also have to let people know, okay, well, when a problem comes up, we've got a plan, and this is part of it. Reviewing current policies to see if there is space to layer in policies to reduce opportunities for bullying. Like one that came up over and over again was the having a no saving seats policy. That could be something that would be challenging to implement, but perhaps with the if there's a universal expectation, it might be easier to operationalize that policy. Also noted was a comment that we need to also make sure that we are maintaining a home-like environment and not making this so institutionalized that folks can't feel comfortable to sit with their friends or be with people that are important to them. In terms of communicating, the idea is to provide regular employee training. This is exactly what Tom said, making sure that we've got training at multiple levels. When I first started learning about trauma-informed care, one of the things that impressed me the most was the philosophy that everybody gets training in trauma-informed care if you're a trauma-informed care setting. And this should really be the same. Everybody should have training. There shouldn't be any paid or volunteer position in which a person isn't getting some kind of training about how this can happen and what is our plan should it happen. As well, training for the clients or residents. The research was interesting. They didn't say necessarily that once the clients or residents received the training that they saw a decrease or they felt more comfortable reporting it or acting upon it. But what was interesting was that staff did. So it kind of, I think, gave an anchor for the staff that they could hold on to that if they needed to address it. There's also suggestions for building in regular opportunities to build empathy. Empathy building activities in those trainings for staff, volunteer, and clients. Hold regular discussion groups around the challenges, like a resident council. If you're in maybe an adult day center, having regular meetings as a center, and really making sure that there is a built-in process for communication. We know in schools there's somebody who is a bullying prevention specialist. Heather and I talked about this. Is there an opportunity that somebody has this role? I mean, that doesn't come without its challenges, but there are definitely opportunities for that. And then the last was advocating inside to maximize autonomy, yet encourage reporting and take complaints seriously, to review the state regulations and advocate for policy changes that would enhance the quality of life for all, and really looking at, in terms of outside those policies that are affecting people in schools or other settings. Is there an opportunity to include older adults and the settings that they're in those policies? It's not to say that they're not imperfect, right? There are some challenges. I don't know if you wanted to talk about some of the challenges that you saw, Heather, about how to manage all of this.
Yeah,
But
sorry to interrupt, Colleen.
are we running out of time?
Yeah, we're at 1
I'm
o'clock.
sorry.
So
Oh goodness.
yeah, so we are going to need to wrap. I want to be respectful of everybody's time. A couple of things as we're wrapping up. It does sound like you have a little more information. So one, would you be willing to share your slides so that we can send them out to participants so they can review those at their leisure? And then also, if you're willing, if you want to drop your email addresses or phone numbers in the chat in case people want to follow up with you directly if they have more questions, and I can also share that information when I send out the link to the video and the slides.
Yeah, I'm sorry that I talked all the way up to the end. Sorry, Heather. I hope I didn't take away from you too.
No worries.
We did have some resources and we hoped that you might be willing to share those.
Absolutely. Do you want to just send them to me in an email? Are they links and I can just send them out to people?
Sure. Do you want me to just give you a copy of the slides and then folks will have that to go back to?
Yeah, you can send me a copy of the slides, and if the resources are separate, then you can send those links also, and I'll send it all out.
Okay.
All right. Well, thank you all very much for being here, and sorry we seem to be cutting off a little bit abruptly. If I saw somebody mention we could do another webinar possibly, if there's interest, we could certainly look into that. We could also, Colleen, you and Helen and I can talk further about maybe we wanting to develop a continuing education program around this topic so we can delve into it in a little more depth. So those are absolutely things that we can look into in the future. I want to thank you all again for being here with us today. Hopefully I'll be able to email you the information before the holiday. Thanks very much all. And I know it's early in the week, but have a great July 4th weekend. And we'll all talk soon. Bye, everyone.
Thank you all for coming.